Hey, good evening, ladies. Thanks for joining me. You know, I came home from work, cut the day short a little bit. I wasn't feeling well, so uh, glad you're with me. I'm gonna stick it out, and hopefully you guys can stick it out with me for Wellness Wednesday tonight. Um, but I definitely didn't want to miss because I have some important information I think that I'll share with you, and I think you'll really benefit. Um, Before I get started, I do want to welcome all you new ladies, new to the group. It's a pleasure to have you. We're glad you're here. And I think if this is your first Wellness Wednesday, um, I think you'll see what we try to do in this group to give you guys the information that you need to help you overcome these health issues you deal with is valuable. And so welcome, and you're in a good place. Uh, I do need to say my disclaimer before I get rolling too much here. So anything that I say during this Wellness Wednesday tonight is health information and not specific health advice. Do not start taking or stop taking or change the way you're taking any of your medications. If you feel like you need to do so, please consult first with your prescribing practitioner to help you do that safely. And by attending this Wellness Wednesday, uh, you know we don't establish a doctor-patient relationship. Um, so, ladies, if you can imagine, I, I love putting puzzles together. So each and every time I evaluate a person's labs, it's like a new puzzle that I have to piece together. You know, how many of you are fans of mystery or Sherlock Holmes like me? Well, as I look at each case, it's clearer and clearer that each patient presents a different story than the previous or than the next will present. And there are many similar elements, yeah, but there are far more individual factors that must be considered. Tonight, this Wellness Wednesday, for this tonight, we're going to go through a case study. And I know going through these has always been a highlight of the master classes that I give. Speaking of which, I am really excited about the upcoming master class, just a few days away now. And it begins on Monday at 7 p.m. Mountain Time. So that'll be 6 Pacific, 8 Central, and 9 Eastern. Um, and it goes through Friday, Monday through Friday, every night at the same time, because I always have so much to share. And I will always add bonus videos to provide even more helpful information too. So um, be looking for all that. So don't forget about the masterclass. I don't really know how you could with all the email and text reminders we send you. And it takes place right inside this group, just like we're doing right now for this Wellness Wednesday. So we'll be posting a link for the workbook as well when it's ready for release. So be looking for that. It'll be pinned in the featured section and likely just all over the group. And you will get much more out of this class, ladies, if you attend live. When you participate and comment, and you're here with all these awesome ladies who are in a similar situation to you know, having similar issues with fatigue and brain fog and weight issues and so forth. You're with like minded women who are also looking for answers and really hoping for a better, uh, healthier future, right? Without the burden of these symptoms and disease. So you'll be with others, many others who have attended previous classes as well and have become patients and who've succeeded as well. So you can lean on them and glean from their experience with the things that they share in the comments as well. Right, ladies? Now, this is an amazing group, and the support that you have when you attend live is awesome. So make sure that you attend live as much as possible. Make sure that you don't miss a session. They all happen in order for a reason. They build on each other. So I'm super excited. I can't wait. This is going to be a big masterclass in our Fix Your Thyroid, Change Your Life group. All right. So put Monday on your calendar, and each day that week, next week, the whole week, Arrange, if possible, to have help with the kids, help with the grandkids, etc. So you can be by yourself and relaxed, ready to take notes with your workbooks or notebooks or whatever. So you can really pay attention and learn what you need to implement to start seeing changes for once. So, as I was saying about the case study, think about it. In medicine, it's like, yeah, come in and it's say like 5-10 minutes, right? And tell me all about your problems. Here's some basic lab tests, and oh, and here's a pill that'll make it right. Right? In traditional medicine, it's a pill for an ill gain. It's a disease and drug therapy model. So it's always about, let's find the name of the disease. And then we have, when we have that name, then and it doesn't even really tell us about the disease sometimes. Uh, there's some creative name for a group of symptoms, even like fibromyalgia or chronic fatigue syndrome. And then there's typically a one size fits all solution, right? So when you have markers for a particular disease, there's a specific treatment for that disease. No individual factors are really looked at or looked for, frankly. I go much deeper into this in the master class, but that's where I'll leave it tonight. Now, because each person's case is unique, as I was saying, yes, with similar elements, but also with many distinct individual factors, each unique case deserves customized treatment. To know what's going on, one needs to get comprehensive testing. So tonight I'm going to go through a case study with the purpose to show you how I analyze some of this comprehensive testing and to show you where these symptoms come from. And first, you need to have some understanding about what I'm looking for when I am evaluating these markers in a different way from a functional perspective. Some of you who have been in the group, of course, have this background, right? Those of you who are new need to have this background to be able to understand why I'm going to go through the testing the way I do. And first thing you may have heard me say a lot is that you still have the power to heal. Your body truly was born to heal. It is a self-healing organism. And many of you may say, however, that you're not sure about that. You've been feeling this way for so many years or decades even, and you're sometimes giving up hope and losing faith, losing that intuition that you still do have the power to heal. And you even start thinking your body doesn't like you or even hating your body for the way you feel. But your body does have the power to heal, and you have to know that when there are imbalances in your body gives you symptoms, right? So that you know something isn't right. That is how it communicates to you that something's wrong. And so the way I approach patients or any person who has symptoms or a disease process is to ask the question, why? What's causing it? Where is it coming from? What's keeping this person from getting better? Why is this person seemingly stuck? And we have to go deep, to really understand the root cause of why someone has a symptom or a disease process. And I know that's it's kind of novel, right? But we think, well, isn't that how traditional medicine works? And it actually isn't, not in the least. So for me, I got to say, all right, why do you have these symptoms? What's the underlying imbalance? What do we need to do to address and reverse these issues? Right? And when you approach it like that, then most of the time the body can heal and the symptoms go away. And your body's voice starts quietly, right? And then it gets louder and louder till it's like screaming at you, hey, girlfriend, you got to figure this out because I'm completely not functioning here and I'm not happy. So you have to keep asking these questions, right? Why do you have the symptoms? Why do you have these disease processes? And really understand what it is we need to do to solve the problem to nudge the body, toward healing itself. The body can heal itself, ladies, and you still do have the power to heal, but sometimes it needs some help. Right? Sometimes the environment that it's in is not conducive to healing, and so it cannot heal. You know, so you really have to understand what's going on underneath the surface, right? And what is the correct path forward. So tonight, one second. Tonight, I'm going to go over just the typical blood work that I do when I'm evaluating whether I can accept somebody as a patient. Uh, Now, we do these, we do other tests that also help me understand even more, but, we don't have time to go over all of those. But I do, want you to think about a couple of things. Number one, have you had all these tests? And number two, do you have symptoms? And then we've got to dig deep to figure out where these symptoms are coming from. And I want you to understand that if you have symptoms, or if you have a disease process that you've been struggling with for many years, and you haven't had these tests done, you haven't had them analyzed from a functional medicine perspective, then there's still hope. Okay? So, again, as many of you start to lose hope because you go from doctor to doctor expecting, a different result from going to the same type of doctor, but all those doctors have the same tools, right? The same tool in their toolbox. They all have the same medication, right? That's supposed to help you. And when it doesn't, as so often is the case, you've got to, look for a different solution. And when you look for a different solution, you decide to go down a different path, then you can get different information and then you can expect different results. Okay. So give me just a moment and I'm going to bring this blood work up. Just a second. I know I always try to have everything ready and good to go. And okay, here we go. Okay, so I'll try to make this as big as I can so you can see. Might be, do want you to see some reference ratings. So if you're on your phones, you might turn it sideways, right? And then you can pan in as well. But here's a little bit of background. And so she's a 47-year-old female, and this is going to be her original blood work that she has had with me, and some of her history is as follows. All right. So she she's about 5'6", and she's 260 pounds, and she's dealing with this obesity, dealing with joint pain and insomnia, headaches a lot, GERD, and she's got a hiatal hernia, and she deals with IBS, right? Typically this alternating diarrhea and constipation, and high blood pressure. She knows she has Hashimoto. She's, you know, in the minority, honestly. Most people, they may know, but most people don't when they have uh, these thyroid issues. And then multiple swellings around her body, whether they're lymph nodes or lipomas, like, several, like uh, sometimes she close to 100 of them, maybe. And she's irritated because doctors don't seem concerned about it, right? They don't seem concerned at all. And she knows something's wrong, but she just really couldn't get any answers for her issues. And um, she's really concerned about these lipomas, or um, these nodes or nodules that are all over. And so she's dealing with, some pain as well in her abdomen, and she deals with brain fog and is forgetful, loses her train of thought. Um, and and she started, because of the pre-diabetes that she ended up finding out she has. She started one of those weight loss drugs, those GLP-1 drugs, again for the diabetes, but because it should also help with her weight. And there's a lot of problems with these medications. right? They have a lot of side effects. And you're going to lose more muscle than you lose fat with these drugs. And I did a whole Wellness Wednesday dedicated to these, the mechanism and the problems with these drugs that I really urge you to go back and watch if this is something that you are considering or even taking. And she really has not, and it did help her lose some weight to where she is about now, but if nothing else has really helped with any of these other problems that she has. And she's tried a lot of different things. In fact, and she had her gallbladder removed. That's significant. Nobody that I that I know of who's had their gallbladder removed has has done well since then, for various reasons. And I also did a Wellness Wednesday on that topic, so you might check that out. But she is taking several medications, and including levothyroxine, which she has been on for quite some time, as well as some cytomel, which is the T3 component of the thyroid. So none of these symptoms are getting better, yet she's being treated for this low thyroid condition caused by the Hashimoto's. And then she's taking so many supplements, ladies. And I know some of you are in the same boat. I know many of you share this same kind of story. um, but she's on 20 plus, almost 30 different supplements, right? I mean, she's trying, obviously, and she's researched and she's smart and she's, really trying to, she's had to take it upon herself to figure this out. All right, well, let's dive in and we're going to start looking right here at the white blood cell count. It's high. For me, I'm going to show you or tell you some things, some ranges that are different than these reference ranges over here. Because in functional medicine, we have to look beyond what's normal and find where the dysfunction is or where the optimal range is. And if your test markers don't fall within the optimal range and you've got symptoms, then there's dysfunction. And I'll tell you, with the prediabetes she has and the weight issue she has, we have to look for a blood sugar problem. And so what will cause blood sugar to rise? Well, we know infection will cause the blood sugar to rise. So white blood cells are elevated above the optimal range of 5.3 to 7.5. She's at 8.4. So we know she's got some infection. Now we also see elevated red blood cells. This is an indicator for heavy metal toxicity. So ladies, when we're trying to find root causes, it's things like this: heavy metals, hidden infections that are going to trigger the autoimmune process that she has going on and that many of you do too. Hematocrit's going to be high because of dehydration, because of toxins, perhaps because of high testosterone. So one of the tests would have to be a hormone test. All right. Now we're going to move down and look at the white blood cells. So neutrophils, these are, let me see if I can, oh, that didn't work. We won't. Hold on. Give me a second. My goodness gracious. Don't want to apply that. Okay. Well, one second. Sorry about this. Okay. All right. So we have her neutrophils, and these are bacteria fighters. So she's clearly got an infection with bacteria when this is over 60%, and it's well over 60%. And she's got a bacterial pattern. She's also got a a parasite pattern. So eosinophils right here. I'm going to change this. We can maybe do some highlighting here. Eosinophils are here. So she's got 4%, which is pretty high for what's typically we look for. And so yes, she's got parasites, and we're going to have to do some extra testing for that too. All right. So we're going to look at her again for a glucose pattern, a blood glucose problem pattern or dysglycemia, and then we see that there's not really a problem with her fasting glucose at 81. That's really pretty good. But we'll dig deeper still. So hang with me here because we'll see some of this pattern emerge. We also see a BUN of 19. Now, optimally, this should be between 9 and, or I should say 10 and 16. So when it's lower or higher, there are problems. And in this case, it's higher than 16. This means that she is dehydrated. Now, ladies, when your cells don't make energy, they don't make water. And so you're dehydrated. She could drink a ton of water and still be dehydrated. So this 19 is significant. This means that she does have a glucose regulation problem or an insulin resistance problem because she's not making energy in some of her cells. All right. And this ratio tells us the same thing. This elevated ratio tells us she is dehydrated. Okay. Now let's look at this anion gap. Now that's not what it says, but I'm going to do some math. 140 plus 4.2, and we're looking at these electrolytes and these electrolytes. These positives minus the negatives. So 144.2 minus 100 minus 20 is 20.2. This is extremely large for what we call the anion gap. This reflects adrenal dysfunction. This will contribute to blood sugar problems. This will contribute to, this is a sign of adrenal problems, blood pressure problems. So now we are starting to see why she has some of these symptoms. Now, increased ALT, when this is over 19, this is a liver enzyme. So when liver enzymes are not optimal, the liver is stressed. This is part of a fatty liver pattern. And we're talking about non-alcoholic fatty liver here. She doesn't drink. And this is significant because there's no treatment for this, but the worse your liver gets in terms of fatty liver, starts to scar and sclerose, leads to cirrhosis, non-alcoholic, we call it non-alcoholic, well, it used to be called NASH, non-alcoholic steatosis, hepatic steatosis. So this means that she's becoming more and more resistant to insulin, and the liver's the first place where that happens, right? When we see this happening, these chronic degenerative processes are in full swing. They're in full motion. Doctors don't have a treatment for fatty liver. They're just hoping that your liver is going to outlive you. And so, if it's not looking like it's going to, then they put you on a liver transplant list. That's all they can do. So this is very much part of the dysglycemia pattern that's affecting her weight along with the hypothyroidism. These are her genes, and I'll tell you just in a nutshell, these numbers right here next to the asterisk, these reflect the genes that she has from her parents that tell us about susceptibility. When we were talking about toxins earlier, heavy metal toxins, now we're talking about biotoxins. And she does have the genes where she is susceptible to biotoxins, where her immune system cannot help her clean these toxins out of her body. So that's significant because the more toxins we accumulate over our lifetime, the less energy we can produce in our cells. So remember that. That also plays a role in this insulin resistance. Now, triglycerides are high because, and this triglyceride to HDL ratio, total cholesterol to HDL ratio, and there is an elevated, and it's not on here, triglyceride to HDL ratio is going to be high. This is definitely insulin resistance. So once again, her weight gain, the biggest factor for her is not the low thyroid, but is this insulin resistance. And so this is a huge finding. And this will help us know exactly what to do, because these triglycerides are so high, reflecting the fat content in the blood. How can she release fat when there's already fat in the blood, right? And this also is a marker for this fatty liver pattern. Now, ladies, I've spoken a lot about cholesterol in the past. Some of you might be wondering, well, wow, why is her cholesterol so high? And it's high because she has this liver dysfunction and she has insulin resistance and low thyroid. So for these reasons, elevated LDL is a symptom, not a cause of anything, but a symptom of those underlying processes being way imbalanced. And so, contrary to what you've heard, and I, again, go back and watch the Wellness Wednesday on cholesterol, to get clarity on this. Cholesterol is not the focus of treatment, but these other things are. So that, yes, we'll see a lowering of cholesterol typically, but that's because your cells are getting healthier when we fix these other issues. And then they're not calling for so much more cholesterol to be delivered from the liver to help them out and heal, because that's cholesterol's job. It's to remodel the cell membranes, to fortify your brain. No wonder she has brain fog, because she's got this inflammation, this insulin resistance, and her brain is calling for more cholesterol to fix itself. This is a way different way of looking at it. All right. All right. So TSH, let's look at her thyroid. TSH looks pretty darn normal, doesn't it? Yes, she's on that levothyroxine and Cytomel, and she's been diagnosed with Hashimoto's, but they didn't do anything different. They still gave her the replacement hormone and called it good, right? They called it all good. Her labs are great. Thyroxine looks normal, that T4, 7.6. Okay, that looks pretty darn good. I'll just jump down here to the free thyroxine, free T4, excuse me. It's pretty good at 0.99. So what's the problem? Is she hypothyroid? Well, we'll keep looking. T3 uptake. What's with that? Has your doctor ever checked that? T3 uptake is a marker that reflects how much available T3 binding sites are in the tissues. So if your tissues have less available access for T3, then you're going to be hypothyroid. Okay. So that's what this means. And this is extremely low. So she is hypothyroid just based on this finding alone. Okay. T3 uptake. All right. Now, reverse T3 is okay, but we look at that. We look at total T3. This is a bit low. All right. It should be at least 100. And free T3 down here at the bottom. Sorry for skipping around a little bit, but we'll come back. This should be at least 3. So we've got some issues with T3, which is the active thyroid hormone, even though she takes some. She takes the Cytomel. She should have adequate T3. Well, it's on the low side. So she's going to be hypothyroid because of this. So if I were to say how much of this weight problem is due to low thyroid, and she does have the Hashimoto's, let me point that out. These antibodies are through the roof, right? Thyroglobulin antibodies right here, right? And then thyroid peroxidase antibodies. These are, through the roof. But that's not being addressed. This is an immune system problem rather than a thyroid problem. And she's being treated as if, thyroid is the whole problem, given this thyroid replacement, and they call it good. And they check her TSH, and that's about it. And they tell her every time she goes in, yep, everything looks good. No problems with your thyroid. So obviously I beg to differ. When we dig deeper and put all the pieces of the puzzle together, this is what we see. Okay. So she, what percentage of the problem is her hypothyroid? I would say probably, 30% of it. But the vast majority of the problem is going to come back to it being a sugar and insulin regulation issue. So blood sugar. All right, so let's dig a little deeper. Iron. She's got low iron, 57. This should be 80 to 90 at least in the blood. And iron saturation should be up around 30%, right? So um, when you have low iron saturation, you're not getting iron to your cells. And every cell in your body needs iron to make energy. So we know something's wrong when all of her, when her iron saturation's low, she's not getting that support from iron. And her hemoglobin A1C, the average over 3 months, 90 days, is good. But again, blood sugar average, is this going up for her? Is she dealing a lot with hypoglycemia as part of her blood sugar problem? Maybe so. Well, we'll dig deeper still. We look at C-reactive protein. This is a marker for systemic inflammation, and insulin resistance and higher insulin levels are going to promote this inflammation in the blood vessels. This is why she's at high risk for a heart attack or stroke, sudden event. It's not because she has high cholesterol, ladies. This right here is why she's at high risk. When this is above 3, you're at high risk for a sudden event. When homocysteine, and it's creeping up, when it's above 5, this means that she's at risk for developing cardiovascular disease, neurodegenerative diseases like Alzheimer's and Parkinson's. This is a marker for poor liver detox function. We already said that she's got a fatty liver pattern and is dysfunctional with her liver. It's being stressed. And when the liver's stressed and not functioning to detox you, the toxins will recirculate. I know she's got toxins. She's got the genes to have these toxins where she can't get rid of them from those genes. So we know there's problems. Uric acid should be 4.5 or less for women. This is another marker for inflammation and dysglycemia with fructose toxicity. This excess fructose that she's got is going to contribute more and more to fatty liver, joint pains. Remember, she's dealing with those and with headaches, right? Uric acid, right? LDH, this should be less than 180. This enzyme in the liver indicates liver damage. So this fatty liver pattern, I'm certain, is already showing, has progressed to where she's already got some damage, some liver scarring. And the only way to reverse that is to reverse the insulin resistance. So insulin, fasting insulin, 10.0, right? This is double what it should be. So when she's got so much fasting insulin, right, this means she's definitely got fat storing going on, and she's going to have more and more resistance to insulin. The more her pancreas makes, the more she becomes resistant to insulin. And this is what I've been talking about this whole time, where she is in this hypometabolic state, not burning glucose as fuel in the cells because they're kind of in hibernation mode, and she is struggling because of that. This is affecting her organs. This is affecting her adrenal glands. This is affecting her liver. This is affecting her thyroid. And high magnesium indicates that she is in a hypothyroid state. Make no mistake. To be perfectly blunt, her doctors are wrong. She is hypothyroid. Doesn't matter that she's taking the medicine. Just because the numbers, her TSH, shows that she's quote unquote normal, does not indicate that she's normal thyroid functioning. In fact, no study exists that shows normal TSH means you have normal thyroid function. So I don't know why we don't, aren't trained this way in medical school, but we're not. Her ferritin is low, so her iron storage is low. This should be 80 to 90 as well. Okay, so no wonder she has the symptoms she has. This is this is it's staring us right in the face. She clearly has a dysglycemic pattern, an insulin resistance pattern, hypothyroid pattern. She's got a toxicity pattern, hidden infections, right? It's all there to show us why she has the symptoms that she's dealing with, and uh, and so what I'd like you to take away from this, um, one second. What I'd like you to take away from this uh, is that she's very similar to many of you, and she felt terrible. She's got all the symptoms in the book that most of you have, you know, and yet she kept going to doctors, every few months to get retested and follow her labs, being told that everything's fine, right? She couldn't lose the weight. She's tired a lot. Had days where she just can't make plans because she can't trust what she's going to feel like to be able to keep them. So key takeaways again, are you your own advocate, right? Were this lady's doctors, were they checking her liver? How long has this liver issue been going on? You know, she had to take responsibility, right? And that's what she did by getting this comprehensive testing. Um, Now, she ultimately uh, did not become a patient, and that was unfortunate. But I'm confident that she would have done very well, just like the vast majority of our patients do, as we find these patterns, as we find these things out, and because if you don't do anything differently, you're every day is the same. Next day is going to be the same or worse. Next week is going to be the same or worse. These things don't correct themselves, right? So you've got to become your own advocate and not resolve to deal with these symptoms for forever, because things are just going to be getting worse. All right. And so taking a look at it like I have is going to help us dig deeper. And we're going to be able to find these patterns where we can treat these all of these patterns, all of these imbalances, all of these triggers for the immune system dysfunction. And every masterclass, I spotlight successful patients. And so I have a few more to spotlight coming up this next week. And it's fun to see these transformations. Now, I have to mention this. I know that the frustration that most of you have is that you have to ask for additional testing from your doctors, right? And you're trying to get some answers, but insurance doesn't cover it, and it's kind of nuts. And I think you need to understand that insurance's job is to make money for the shareholders to make a profit. That's it, right? So they don't want to run tests that don't change the treatment. It costs them money. And so they look into their toolbox, doctors, and they have thyroid hormones, and they see what they're giving you is always these thyroid hormones. And so running all of these other tests and even testing for antibodies to see if you have Hashimoto's, which is the number one cause of low thyroid, it doesn't change their treatment. So the insurance company deems it unnecessary. And so, you have to realize that they're not going to run all of these extra tests because you're in a drug therapy disease model. And if there's not a drug, then it's not necessary. But in this world where we're looking through a functional lens, there's a lot of things we can do. And the data we can gather from all this information absolutely dictates changes treatment. Okay. So it's absolutely necessary. Even with Medicare, their guidelines say if a treatment is to reverse a disease process or improve quality of life, it's not medically necessary. So this is a sick care model, ladies. It's not a health care model by any stretch. Um, if you want to be healthy, you have to stay out of the sick care, right? Health is not sick care. Health is preventing disease. It's it's finding yourself without dysfunction, right? It's putting you in an optimal state of function. Okay, the other thing I want you to take away from tonight is that I hope that you have some restored hope and that you're not going to give up because there are answers. Throughout the group, you're able to see success stories. These are ladies who have followed the same structure that I've provided. They've got the comprehensive testing done. They've gone through an analysis with them like I've just taken you through. They realize what their issues are. We take them uh, into customized care, and they get awesome results. And that's what you're seeing with these ladies that are sharing their stories with you. Okay, so you just have to figure out what it is that's causing these symptoms, and then that will help you figure out what the solution is. Okay. Now, next week in the masterclass, we are going deeper into these concepts and really understanding what they mean. Because tonight I really didn't have a lot of time to go into all the testing, and but we're going to go into the secrets of why you can't lose weight, why you have the fatigue you have, and I've touched on some of those tonight. Even what are some of those mental blocks that we carry around when we don't even realize that we're carrying them around, that make us, if we do lose weight, we gain it back. Or if we can't, sometimes we just can't lose the weight at all because we're stuck. And we're going to talk about some of these and more concepts in depth. All right. And do some more case studies so we can understand what is going on underneath the surface. All right. So make sure you join me. I'm excited. Make sure you join me next week, Monday through Friday. You don't want to miss it. And I love to see so many people post their success stories too. Some of them, I should say, most of them are patients, and they're going through my program, and we're really tackling their root causes. But some of them are not my patients, and they've only attended the master class, and some of them, they're really losing weight, and they're getting their energy back, and they're turning their lives around, even just implementing the tools and strategies that I'm going to talk about in the class. So make sure you attend the masterclass because you're going to get so much information, and attend live. So make arrangements that you need so that you can make that happen. And if you're new to the group and have questions at all, or if you're confused about how to attend, make sure that you reach out to Cherry Ann. She is your masterclass concierge. So if you know how to DM, you may DM her, or you can text her at 208-842-4466. Okay. And she'll help you out. So if you have any questions or you have any trouble, just send her a message. Again, that number is 208-842-4466. And she'll help you out with whatever it is you need. All right. So make sure you attend the masterclass next week, the 9th through the 13th. All sessions are important. All right. And there will be some bonus material always that I add as extra after that as well. And if you're not registered for the class, Cherry Ann put the link in the comment section, and it's held right here in this Facebook page. And just like we've been watching this, this Wellness Wednesday tonight, that's what it'll be. And the link to register, and you do want to register because I do give you a lot of information via email, and then there's reminders and text messages so that you don't miss out. Okay. So again, put it on your calendar, set a reminder in your phone. Okay. Well, I'll leave you with that tonight. We've gone a little long, but that's okay. I hope you all have a great rest of your week and weekend, and I'll see you back here in the group Monday, ready to go for the class. All right. Take care, you guys. Have a great evening, and remember that you still have the power to heal.